Hello, my name's Marion and I'm here to talk about compassion and ask a few questions. What is it? What isn't it? And does it matter? And does it matter as we move forward within this pandemic and as we develop virtual volunteering? We know it's necessary and we know it's wanted, and it's a critical component of healing, and there's plenty of evidence to show how it saves lives. But it's not just a nice thing to have. Compassion's different from sympathy and empathy because it requires an action. So for me, in a nutshell, compassion is empathy plus action. But it has an impact on both parties. We know that compassion changes you when you're involved in it. We know that compassion's good for our health, it addresses burnout, and those strong human connections boost our morale, and that's definitely needed at the moment. What it isn't, it's not universal. One person's compassion can be another person's cruelty. So as well as having clinical and personal benefits, it also has a cultural component as well. And it's not just a person-to-person interaction. We have issues or levels of compassion, organisational levels and societal levels as well. And self-compassion is part of psychological well-being. I have to read off the elements of psychological well-being. Psychological well-being includes positive relationship with others, personal mastery, autonomy, a feeling of purpose and meaning in life, and personal growth and development. And that's quite an ask. So I'm going to focus on just one element of that, compassion. And for me, it has many, many questions. So it's how we deliver care, how we design care, and also how we care for ourselves. So here's my questions. For health partnerships, the context is crucial. So within projects, can compassion be created? Can it be counted? For our health professionals, within a competency-based curriculum, there's another question: can it be taught? Can it be assessed? And for wider health programmes, does it feature in the conversations we have about quality? If not, should it? We probably all remember a moment when we experienced really high quality compassion, and maybe when we experienced low quality compassion. And we probably remember the impact on us of both, but may struggle to articulate or explain that impact to others. So we know what lack of compassion feels like and what loads of compassion feels like. But is there some kind of objective scale that we could compare people's experience of it and giving and receiving it to others? And this all comes into the virtual conversations then. With the move to digital healthcare and digital partnership support, there's a question as to whether this efficiency and accessibility that really is a positive in many ways is going to help or hinder compassion. And so can e-health or e-learning create connection and compassion? And does being on screen make a difference? Now, there are some studies that show the anonymity and the distance creates better empathic communication and online communities, but some people don't think that at all. So we've got a real debate going on here. So for me, the online positives of compassion are the removal of geographical and timeline barriers, which means that the information and the resources and support can be available anytime, anywhere. Conversely, the online negatives mean that online means that as a health professional or a health partner, you're never off. And people can miss the emotional signals and cues that needed to convey empathy that are noticed in face-to-face, and also can feel pressure to be on all the time. So why does this matter really to us? So the use of the digital platforms similar to Pulse are going to be supporting partnerships as we go forward and creating this transformational shift in the context in which we work, the manner in which we work, and the processes involved. And the web platforms already enable us to engage in computer-based communication. As we know, there are many web-based platforms that help psychological interventions. Mental health support already has bots involved. And so there's another question for me actually then: does compassion need to be human? In my clinical work, I met the robot Pepper, And I felt a compassion connection with a robot, which was very strange. So this has been a list of questions, really. And for us as we're moving forward, can we measure compassion? What does this look like for our peer-to-peer support? Can we educate for compassion online? What are the competencies and skills required to practice or support people compassionately online? How do we count the competencies for digital empathy and compassion? Does compassion require a human-to-human interaction? And then there's some infrastructure issues as well. From a systems perspective, what principles, policies and processes are needed to support compassion and compassionate health partnerships, face-to-face or online? And what educational and ethical guidelines, resources and networks are wanted and needed for partners to enable this to happen? Moving forward, we did a better understanding of how we may be compassionate in a digital context, and we need to consider the barriers and enablers to this, and also the unintended consequences of going virtual.